Eating disorder is a maladaptive pattern of eating that is affecting your physical health or your psychological health. But that should be persistent. Like it should not be once in a while. Something that is persistent is going on for a longer time, and a pattern has been established of eating that is unhealthy for you. So that is called as an eating disorder. The common ones that you may have heard the names of are anorexia nervosa, then there is bulimia nervosa, there is binge eating disorder, and in kids we see restrictive food intake disorder or pica or rumination. So these are the types of common types of eating disorders that we see. These patients will basically have a fear of gaining weight. So, and their perceived notion of their body is distorted. So they may be very thin, but they may feel that they're overweight. So that's why then they restrict the amount of food that they are taking to the extent that it starts affecting their physical and psychological health. So that's anorexia nervosa. Then the second one that we'll be talking about is bulimia nervosa. So in bulimia nervosa, what happens is these episodes of restriction of food, and there are other episodes also in which you'll be binge eating. So you lose control over the urge to eat, and you eat so much that you compensate it with purging behaviors. That is the food that you have taken, you want to take it out. So people use ways like inducing vomiting or using medications like laxatives, diuretics, or doing excessive exercise. So it has compensatory behaviors also that is called as bulimia nervosa. And the third one that I'll be talking about is binge eating disorder, in which there are episodes in which you basically again lose control over eating and you eat a lot of food that is inappropriate to your age or circumstance. So you're eating like inappropriate proportions of food in one go. And these people are usually obese because they are having persistent pattern of overeating. So that's called as binge eating disorder. PICA is when you're eating non-nutritive or non-food substance. That again, that pattern is continuous. So you that usually happens like you may have seen kids who are eating chalk or they're eating soil or they're eating plastic, gums, something that is not food. They are eating that. So that's called as pica. It's also seen in pregnancy, but that's kind of physiological, wherein the patient they want to eat something specific, and that's non-food, usually chalk or soil. So, but in kids, it's like they are eating something that's not food persistently, and that's causing complications, or that's causing problems. For example, intestinal obstruction may be there, and stomach issues may be there. They may get infections. So that's pica. Eating disorder patients are usually very secretive around their food habits. And it's difficult to find that these patients have eating disorder. But if you see anybody around you who is losing or gaining weight very fast, so if you see a pattern that they are either gaining weight very fast or losing weight very fast, and they're very rigid around their patterns of eating, or then if you can see they're inducing vomiting or excessively exercising, then you'll also see that they have a fear of gaining weight. Though they are thin, still they say that no, I'm very fat. So they have body image issues. Their perceived notion of their own body is quite distorted. Along with that, usually patients with eating disorder have anxiety or depression or underlying issues also, emotional issues. So you'll see the changes in them. They are withdrawn, they are talking less, they are secretive, they may be more irritable. And in some cases of anorexia nervosa, if it's affecting their physical health, they may have complications also. So that's how you come to know. And if you see somebody like that, then it's better to take psychiatric help. A risk factor comes from the causation. So psychiatric disorders, as I told you, are multifactorial. So one would be genetics. That is, if somebody in your family has had a eating disorder, then there is more likelihood that you may suffer from it. Then it's the environment. So the cultural environment, let's say, what are the standards of beauty in a particular culture? So the culture that emphasizes a lot on beauty, the body size, shape, what kind of messaging are you giving to the individuals about their body size? That can also be affecting how you perceive your body. So that can also lead to these eating disorders. So it's not just one factor, but multiple factors coming together. Then it's the psychology of an individual. So, for example, if somebody has low self-esteem, somebody has poor interpersonal relationships, family issues, some kind of abuse, sexual, especially sexual abuse, or low self-esteem, body image issues, or a sense of inadequacy, loneliness. These all emotional issues can lead to or can manifest as an eating disorder. Diagnosis is basically clinical. That is, if an individual comes, I'll take a history and I'll do a mental status examination. And as I told you, if I see the symptoms, that is, depending upon the type of disorder, if I see a persistent pattern of eating that is unhealthy for an individual, for his or her physical growth or psychological growth, then they may be diagnosed as an eating disorder. So there has to be a persistent pattern, a maladaptive pattern of eating. And I told you the symptoms. For example, for anorexia, there will be a restriction in the amount of eating. For bulimia, there will be compensatory behaviors. For binge eating, there would be patterns of binging again and again. So according to the symptoms, we diagnose them to be having eating disorder. First of all, would be evaluation. That is, we try to identify what all issues do we need to address. As I told you, eating disorders usually are accompanied by other problems also. For example, there can be anxiety, there can be depression, and substance use disorder can be there. So we need to identify all the areas that we need to address, and then we start with the treatment based on the symptoms or what areas need to be addressed. One modality of the treatment is medication, and the medication would be either an antidepressant or an anti-anxiety medication. And then second part of the treatment would be your behavioral techniques. So in that, we usually work on the emotional regulation skills of an individual or the body image issues if they are suffering from that, or coping skills for interpersonal issues. So depending upon the target areas, we devise the therapy for that particular individual. Complications would be two way. One would be physical and one would be psychological. Physical usually happens in patients with anorexia nervosa because they restrict the intake to that extent that they may have electrolyte imbalances. They may have to be admitted for that. They may have cardiac issues. They can die due to cardiac arrest. And they can have, there is high rate of suicide in individuals with anorexia nervosa. So these are the complications now. Patients with binge eating can have obesity and anything associated with obesity. So these are the physical complications mostly, and the psychological complications. I told you high rate of suicide in anorexia patients with anorexia, and there can be other disorders also that can accompany eating disorders because of the poor emotional regulation skills that these patients have. So it can be anxiety, it can be that the patient starts using substance, and there's substance use disorder also. Not just for eating disorder, for any psychiatric disorder, I feel the first and foremost thing is to get aware about psychiatric disorders so that you can help an individual seek treatment. So most of the people, they stigmatize psychiatric disorders, including eating disorder, and thus they are not able to help the patient. So if you're blaming somebody for having a disorder, of course, it's not going to help them. So the best way to help somebody is to, number one, get aware of the disorder and then help them seek proper treatment, because that's going to really help them with the disorder, and their behaviors change. The way they behave, that also changes. And then help them stay consistent with the treatment. Then when the patients start treatment, then we involve the families also on how they can interact with the patient, so that they work on their emotions, they work on their social skills. As I told you, in many cases, the individuals have underlying family issues, interpersonal issues. So then we can plan a family therapy or a group therapy. So that depends on the kind of individual issue that the patient is facing. The causation is not very specific. There is no one thing that can actually prevent it. But what would be a better way to live is that we correct the messaging around beauty in general. That I say for not just for disorders. That's an appeal from my side for the society. If you're raising a girl or a boy, the way they see their bodies has to be healthy. So the fake ideas of beauty that are prevalent in the society is getting better with the time, but that has to be shattered. Every body size is beautiful, and the kids need to be told how to basically accept their bodies as they are, then how to keep it healthy, And then we also need to work on emotional regulation skills of the kids. That's not taught in the school, the emotional intelligence part. And it's the underlying emotions that are actually manifesting as eating disorders in most of the cases. So we need to work on emotional regulation skills of the kids. So if you feel that there is any deviation, don't wait for a deviation to happen. Just like we don't wait for a disease to develop, no, we start going to the gym, we are maintaining a healthy body. Same way, maintain a healthy mindset. And for that, if you need to seek help, seek help. So prevention, yes, it will prevent psychiatric disorders from developing or eating disorders from developing. If we work on a kid's social skills, emotional skills, basically emotional regulation skills, their idea of beauty, their idea of body image, we are able to give them healthy interpersonal relationships. So that's how we can prevent and make the society a better place to live.